Could you tell me your name, please?
Landon Oster, 9/14/93.
Very good. And do you have any allergies? I don't see a bracelet here, but...
No, I do not.
Okay, well, we still want to get a bracelet just to show that you don't have any allergies. I'm going to be doing a brief head-to-toe assessment today. That's going to include skin and heart and lungs and muscles and abdomen and a few things. And so if you have any questions, let me know. And I'll be doing my very best to keep you covered in private. And at some point, I'm going to get on that side because I need to be on your right. So let's get started. And I will be pulling here for some privacy. And again, I'll try to keep you covered throughout. So starting off, before we get started, are you in any pain today? That would be a good thing to know.
No.
And just so I'm clear, on a scale of 0 to 10, with 0 being no pain and 10 being the worst possible, how would you rate it?
0.
Okay, great. Now you told me your name, but tell me, where are you today?
I'm at the Pickard Hall Assessment Lab.
Okay. And what is today's date?
The 15th of April,
Year?
2015.
And approximate time?
11:30.
Okay, so he's alert and oriented to person, place, and time. I'm going to be checking a couple of cranial nerves, and I'm going to start with cranial nerve 2 and 3. So first of all, I'm going to start with measuring your pupils. Cranial nerve 2 is the optic, and cranial nerve 3 is oculomotor. So you'll just look right at here at me. There it is. I'm going to call those, well, I'll call that a 4 and a 4. Okay. I'll get on this side so you can see these stuff. So first I'm going to, if you would just actually look straight at me, I'd be right in front of you, but I don't want to stand in front of the camera. Look straight at me, and I'm just going to be shining directly in this eye, on the side, okay? Now this eye. So they respond direct. Would you actually just put your hand in the middle here, and I'm going to do test for consensual. Look at that eye. Got that one. Okay, great. Last test. Would you look at the very back wall, and then, so look straight at the back wall, and then now shift your gaze here. Okay, very good. So, pupils were 4 millimeters bilat, equally round. They reacted to both direct and consensual light and accommodation. They constricted and converged. And that was cranial nerve 2, optic, and 3 oculomotor, so I could say perla because I did all of those. Cranial nerve 7, the facial. Would you smile for me? Would you show me your teeth, which you just kind of did there also? Raise your eyebrows and puff your cheeks. Okay, great. Cranial nerve 7, facial nerve is intact as evidenced by symmetric facial movements. I'm going to just look in the mouth here. And I don't have to put the gloves on, but I'll go ahead and do it this time. Okay, so I'm going to be looking the sides of your mouth, under your tongue. I'm going to have you stick your tongue out. And a couple of bits here. Okay, so I'm just going to, I'm not going to gag you. Okay. Great. Stick your tongue out, please, up to the roof of your mouth now. Okay. Oral mucosa and tongue are pink, moist, and free of lesions. Okay, great. I'm just going to take my gloves off. So I'm going to be listening to your lungs, and I'll call here. Every time I put my stethoscope down, if you would take a breath in and out through your mouth a little deeper than usual, let me know if you get a little tired. And I'm going to start with posterior. And I know you guys can't see, so you'll just have to trust that I'm doing it in the right spot. You can go over it on the mannequin if you'd like. Okay. So here we go. Not moving the stethoscope. Okay, flaring out at the bottom a little bit. Okay, very good. I'm going to undo this bottom part just a little bit so I can come in here. Okay, and again, I'm not going to, would you move your arm just a little bit? Okay, deep breath. Okay, and I think because you're sitting here, I think I can do this one right here. go ahead and scoot back from me a little bit. And just keep sitting up, but actually go ahead and lay down, that'll work. I think that'll work fine. Okay, so, you know what? I'm gonna loosen this. Sorry, raise it just a little bit. Let me undo that. Okay. I'll come up through the bottom. Upper thorax. Long breaths. Okay. Come up here. Lower thorax. Great. All right. So breath sounds were clear, anterior, posterior, and lateral bilat with no adventitious sounds. And now I'm going to be finding my starting point. Angle oblique, second intercostal space, right sternal border, and he's got a Littman. So I'm going to go just once, varying the pressure. Just breathe normally. High pressure. Okay, and if I did not have that kind of stethoscope, now I would turn it to the bell and actually open it and flip it and go back up. Of course, I'm taking my time. Remember, if you have a female and they're wearing a bra, easier to do the first 3 above the bra, come up and under, okay? All right, so I heard S1 loudest at the apex, S2 loudest at the base, a regular rhythm. Did not hear any extra heart sounds or murmurs. Okay, I'm going to be first inspecting the abdomen. I'm going to get it eye level. So, I'm covered here. Rounded, symmetric. I don't see any bulges. Don't see any pulsations. And I know I asked you generally about pain, but are you having any particular pain in your abdomen?
No.
Okay, very good. Well, I'm going to just listen first. If I had turned my stethoscope, remember I have to turn it back now. Diaphragm. Okay, I'd say the lower quadrants are active and the upper quadrants are hyperactive. Okay. I'm just going to do a little tapping here, so let me know if there's any tenderness when I do that. Get my hand right there. A little better sound. Okay, so I heard tympany in all 4 quadrants. Just some light palpation now. Let me know if anything's tender. Tenderness, okay, no bulges, no distension. All right, very good. And you know what? I forgot to ask you to bend your legs. Let's try that one more time. Should I do that? Rewind. Okay, so it just kind of relaxes the abdominal muscles. Okay, you can put those down. You can sit back up now.
Is that throughout the whole abdominal exam?
Or just for
You know,
percussion?
just so you don't forget, it's probably better to go ahead and do it, but at least for palpation especially.
Oh, okay.
All right, so I'm just going to be feeling some temperature of your face. And that's equally warm by lat. Arms are a little bit cooler, but they're equally, except the hands are cooler. All right, I'm going to check your radial pulses. 2 plus out of 3 plus by lat. And have refill. If you have nail polish, you need to do that on the tip. It doesn't. Okay, less than 2 seconds times 10. Would you squeeze my fingers, please, as hard as you can? Okay, 5 out of 5, equally strong bilat. And let's see, like this will be fine. In fact, that will be very good. So, temperature is equally warm bilat. Actually, oh, the toes are quite cool. All right. Do this just like this. I'm going to feel dorsalis pedis pulse. 2+ out of 3+ bilat. Refill of the toes. Tickle, sorry.
Yeah.
Should we do a plantar reflex? Okay, less than 2 seconds times 10. There's no pretibial edema. Okay, and since you're kind of laying back like this, I'm going to do the dorsiflexion, plantar flexion. So point your toes to your nose and push as hard as you can towards your nose against my hand. Okay, very good. Come on, gas. All right. So 5 out of 5, equally strong bilat. Now scoot forward just a little bit more to test your knee reflex. So just relax, and if I can't get you to relax, we'll try something else, but let's see how it goes first. There we go. One more time so we can get that equal. Okay. I'm bordering on a 3+ out of 4+ bilat. It's close. All right. Well, very good. Let me just take a quick look at my list and see if I can kind of forgot anything. Did a lower pulse. I did radial pulse. Lower strength. Lower strength. Do you think I forgot anything? Okay. All right. I'm going to do some hand hygiene over here. What's in that bottle? Okay, very good. Well, thank you so much, and thank you for being a, sort of say contestant, but a patient. All right, so see how it goes it flows pretty well.